Hello everyone and welcome to yet another insightful and informative episode right here at Medical Insights. My name is Dr. Andy. Soon after the celebration of a wedding, the yes I do, for many young couples, the journey to conceiving ensues. Today, ladies and gentlemen, we are in Pretoria to meet Dr. Cheryl Myler, who's going to take us through the antenatal care journey for a pregnant woman. What to expect, what to plan for. She's going to unpack all of that for us. She has over 9 years of medical experience and has worked 6 years with pregnant women. And I'm sure that she has a lot to share with us. Come, let's meet her. Dr. Myler, welcome to Medical Insights.
Thank you.
So lovely to have you here. So today we are talking about antenatal care. But before we get into the gist of the topic, can you tell our viewers at home who is Dr. Myler?
Hello everyone at home. Dr. Myler is a wife, a mother of 2, and a medical doctor currently specializing in obstetrics and gynecology.
Sweet.
Yeah.
You've spent over 10 years serving, helping mothers deliver. How has the 10 years been like for you?
It's not really 10 years, it's about 6, I think.
Oh, in obstetrics and gynecology.
Yes, it's in holistic. Yes, true.
Okay.
It's been quite fulfilling because I believe that if you really want to change the nation, you must change a woman's perspective, and that's the field that I got to do that. So it's quite fulfilling. I feel like I'm making a difference.
That's awesome. That's great. Now, when it comes to pregnancy, what is the first sign of pregnancy for a woman?
The first sign is what everyone knows. You miss your period and you start wondering, is it late or is it ever coming? So yeah, that's the first sign that everyone would know that you miss your period. And then there's started to feel some changes on your body that you don't understand. You feel like, no, I'm catching flu. You start vomiting, you're feeling dizzy.
I wanted to just, before we get into the other symptoms and all of that, the concept of missing a period. Normally when a period is regular, it should be coming at least every month, you know.
I think every woman can time their cycle. You know, I'm expecting to see my menstrual cycle. Some periods are longer, others are shorter, like a cycle. Some cycles are longer, some cycles are quite short as 21 days, others can be as long as 35 days. So, but we know that there are certain issues that influence that too, your stress levels and all those other things. So some cycles can be delayed. And in that instance, someone might not know if they're pregnant or not, or if it's just a delayed cycle. So I think so far, every woman knows themselves from the time when you are 13, when you start missing your first cycle, then you know how you can time your cycle and when you can expect your next period.
Okay. All right, Dr. Myler, now let's put it in the context of this perhaps young married couple, you know, they just said their vows and now they are planning a journey on conceiving. Upon missing that first period, what should be the next step?
I think your question should go back to what should they have done before they even try to fall pregnant. Because yes, the couple is married and they are planning to have a baby. So that is where a lot of things should come into place. Like say there are diseases that you may perhaps be having. And there are drugs that can influence the fetal growth, the fetal organogenesis that happens in the first 3 months. So when they are planning to have a baby, that's the first step. They need to go to see their obstetrician and gynecologist to plan the pregnancy. If there are drugs that are on that may be teratogenic or be harmful to the growing fetus in the woman, they need to change that. If the mother is having diseases that can worsen in pregnancy and cause their pregnancy to be worse, then they need to have all of that being controlled. Say they have diabetes, they have to be sure that is under control because it has an influence and an impact in the pregnancy itself as well as the mom.
So basically, Dr. Milo, what you're saying is that pre-conception itself, there's that pre-conception journey, things to consider and things to think about, especially when you mentioned about drugs or toxins and all of that, which brings me to the next step, that once one has missed their period, then the confirmation of pregnancy, I think, is just as important. What happens then? What should be the next step then?
In some cases, it may be too late to do anything.
Okay.
Like, I'll go back to the drugs. For instance, if you're on warfarin for whatever reason, we know is teratogenic. You should have stopped it prenatally. By the time you miss your period, you are already 5 weeks into the pregnancy itself, and a lot has happened in a sense of the baby's development, which could have, whatever drug you were taking could have harmed the baby.
Okay.
So we start by revising your treatment, getting you under control, and then you can start planning your pregnancy.
Yes.
And in the planning of pregnancy, that's where you start your prenatal vitamins. You don't start them after you miss your period, because you need them for the developmental, the neural defect, neural tube defects. You know, you need your folic acid to prevent that. You don't take it after you miss your period. We prefer that you take it before you even fall pregnant.
Wow.
So those are the things that our people don't really know. They think pregnancy, we start looking after it once you miss your period, and that may be too late sometimes.
That's quite intriguing. And I think that's why we have all of these specialties, healthcare specialties, and they are a blessing to us as the body of Christ, and we should utilize them to our benefits. And so now let's go to the confirmation of pregnancy. The pregnancy test has been done, and when does one now, when should they go for their first antenatal visits, ANC?
Yay. Yes, the couple, and please, fathers, you should accompany your wife. This is a journey we should all take together. We were together in this, so we have to be together throughout.
Yeah.
So yes, as soon as you miss your period, you hold hands and you see obstetrician and gynecologist. But those that don't afford, because affordability is an issue, even at your local clinic,
yes,
we are
definitely.
so fortunate that in South Africa, the government is giving this to us free. So we should take advantage of this, and we do allow for husbands to accompany their wives throughout this journey. At every visit, you sit in with the doctor together, and it's quite beneficial. Because some things we explain to the pregnant mom, and she doesn't know how to relay the message to the husband or the partner. So when they are there together, we can just explain everything to them at the goal.
That's great and awesome. And you know, as the couple is coming, what should they expect is going to be done on that first visit? I know there's blood tests to be done. Can you take us just through what you guys call as booking bloods? Just, you know, just for them to have an idea on what to expect.
Yeah, so now if you did the things correctly, you should have seen them before you felt pregnant.
Doing things.
So now we are doing damage control. You're already pregnant. So that is where we start with taking a history. Said you're a married couple, it's your first baby. So we take history. We want to know what's been happening in your family. Like we do the genograph, we take medical history, social history. We are hoping you're not smoking or taking drugs, so because that is purely harmful and we don't encourage them at all.
Yeah.
So after we've taken the history, then you know as medical profession is history, examination, and then we move to test. So after taking your history, you pick up whatever it is from the history that will now direct you into the examination. But either way, you do head-to-toe examination. You check every little thing. And whatever it is that you pick up along the way, then you have to advise as you go along. If you pick up that the person is, hygiene is a problem, you advise on that. If you pick up that they are not eating healthy, you advise on that. Or they were eating things that are not good in pregnancy, you also advise on that. Then you examine them. There are standard bloods that we take at every antenatal clinic. That is checking if your HB is fine, which is the blood levels in your body. We check your BP, which is just the blood pressure, because there are 5 things that causes maternal deaths in South Africa, and one of them is hypertension and hypertensive diseases. So it's good to check that BP. Yeah. And the urine dipstick, it can tell you a lot. If patient has infection in the urine, if they have glucose in the urine, can direct you towards checking if they could be diabetic. If the urine has protein, some protein can be little, which is expected in pregnancy, but at some level, then you will start looking into other diseases. So we do the side room tests, and those are that. And of course, we need to confirm, it's just that in our public setting, we do not have facilities to check every single pregnant person at booking to have a sauna.
So at first visit, this, let's say one missed their period, perhaps 5 weeks at the time they were expecting it, can they already go for the ANC first visit?
That is true.
Okay, so you are saying at 5 weeks already an early scan, because that is what you're getting to.
That is true.
An early scan can already be...
can be done. First of all, we need to confirm, is this pregnancy sitting in your womb? Because you know there are conditions such as ectopic pregnancies where you are pregnant and it's not in the womb, which can be fatal, which can kill you. So it's good to have that first scan to see that you have a baby that's sitting in your womb. And at 5 weeks, we can already see the fetal heart, which is very exciting for all this.
And I'm sure it should also be just as exciting for the couple as well.
Yeah, so it's very exciting to see that little heart beating, and you know, it just prepares them even psychologically now to say, we are having that baby. So,
wow, that's awesome. And what else can the scan tell? What do you look for? Just the position
at 5 weeks, at 5 weeks at most, you just check the pregnancy, how far the pregnancy is. If it's 1 or 2 babies, we can already see if it's one baby or not, and then to see if it's sitting inside the womb. Basically, that's what you can see with the very early scan. And then there's scans that you can do afterwards that can tell you a lot more about the pregnancy.
Wow, that's such a mouthful, and so much goes into that first antenatal visit, which shouldn't be missed.
First visit shouldn't be delayed, because we have our people thinking that the first antenatal care should be when I'm 3 months pregnant.
When you're already
are far gone. You know, the neural tube defect has already occurred if it's supposed to occur. So it's best when you miss that period, you go immediately. And our people like coming to us and saying, you know, the sisters chased me away from clinic, which are all not true. So I always advise them that if they chase you away, get them to write somewhere that I'm chasing you away. And none of them have come back with anything like that. So it's basically not true. They know at the sisters at clinic that antenatal care starts from the time you miss your period, and that's when you should have your booking visit.
Wow, the doctor has said it. There's so much that goes into that ANC as you plan, you know, as you anticipate that whole journey of gestation. So much that she has highlighted, and we're going to take a short break right now. When we come back, we learn about what determines the gender of the baby. Is it the mom? Is it the dad? You know, all of those interesting questions. Make sure that you stay tuned. We'll be back shortly.
There is an unprecedented stirring of the waters, and the healing streams are flowing again.
It's flowing to every nation, every city, and every home.
If there's anything that's been wrong in your life, especially your body, God's peace can get a hold of your system and bring an end to the sickness that you have been going through.
It's time for an unforgettable outpouring of the miraculous at the Healing Streams Live Healing Services with Pastor Chris this March, from Friday the 17th to Sunday the 19th of March 2023.
God sent me to you to bring you his healing. That's why I can utter words from He. And it doesn't matter where you are in this great world. As I speak those words, the disease, the sickness, the infirmity has no option than to leave you.
This is your set time for a miracle. Register now at www.healingstreams.tv/LHS. For more details, call the number showing on your screen. The services will be broadcast live on www.healingstreams.tv and on the Healing School mobile app. The Healing Streams live healing services with Pastor Chris. Your set time for your healing.
Welcome back, ladies and gentlemen. You are still tuned to Medical Insight. Today we are talking about the journey of being pregnant, the antenatal visits, how many visits you're supposed to have and what to expect. All of these things are being unpacked right here today. Dr. Maila, it's still awesome to have you here. Before the break, we highlighted the importance of going for that visit as early as possible, whether private or public. There's no excuse. One should book as early as possible. I'm sure viewers at home are sitting there, and maybe there's a young couple sitting there, and the mom is like, I want a boy. The dad is like, I want a girl. What determines the gender of the baby?
It's God. It's none of them. Well,
right. Yeah,
but
definitely it is God.
The mom always gave out, yes, you know, we have what we call the autosomes, and then we have the X chromosomes. Yeah. So the mother always have, all in all, a human being has 46 chromosomes, 23 of which will come from your dad and 23 from your mom. So your mom always give an X chromosome that determines the gender. And your dad, you can either get an X or a Y from from the dad. So it's basically a male sperm that determines the gender of the baby.
Yeah, but this is like at cellular levels when cells come together. Fusion, yes. True. So the mom will always bring the X, and then the dad X or Y.
So if the X from the mom and if the dad brings on the table another X, then you end up as a girl. And then if the father brings a Y combined with the X from the mom, then it's a boy. So it's mainly the husband. We hear issues like it depends on the environment, like the incubator also. Okay. Apparently a male sperm, it lasts longer than a female sperm. So if he deposits females, like the spermatozoa inside the vagina, the female sperm lasts longer, it thrives longer, like it can take up to 3 or 5 days before the sperm dies. And then a male sperm dies quicker, within a day or two. The male sperm. The female sperm thrives. It lives longer in the genital, the genus of the woman, in the womb. So, but a male sperm dies quicker. So say now they have intercourse today and the woman ovulates in 3 days' time. And the male sperm would have died by day 3, but the woman's sperm, the female sperm, may still be alive. And they may end up with a girl. There's more chances of them ending up with a girl.
Because of the whole environment.
Yeah, but I'm not sure how that's scientifically.
Okay.
But there's that possibility.
The hallmark of it is that the male person determines the gender, but not like willingly, at biological level.
Yes,
that is what happens.
Yeah, that's true.
So there you guys have it. The male determines the gender. So whether it's going to be a boy or a girl lies with the male. Biologically, not
with
like
the
mentally.
No, nothing like that. So, but there's also those fertility things, like if you are so pro, I want to have it, and you have all the money in the world, they can do these genetics things where they modify and then they pick the genes and they go for the XY, and then you end up with a boy, XX if you want a girl.
All right.
So that has in vitro things, more advanced.
Before the break, we spoke about the ANC visit. We dwelt so much on the first one. But let's say for this woman, it's her first time being pregnant. How many of these visits can she expect to have in the period of 9 months?
She'll basically live in the hospital or in the clinic. I'm joking. It depends on the pregnancy itself. We cannot predict what's going to happen, and also depend on the medical condition or how healthy the mother is. So if you have some certain ailments in the pregnancy, you'll obviously have to come see us more often than someone who is carrying it well. There are those that are not carrying it well, they have diseases, they have this, you change this and that, and when you change, you want to see them often to see they're improving. So we can't really put a number on the number of visits you can have.
But the hallmark is that they are multiple visits.
They are very
One
much,
should expect to have multiple
you will
visits.
frequent the health facilities.
Now, let's come to the issue of women prefer to count their months, like 2 months pregnant, 3 months pregnant, but I know doctors prefer
Weeks.
counting. Yes, why is that?
Because months is not, it's vague. We don't know. Like, once you miss your period, you'll say, people say, I don't know how far I am. And then you find that sometimes they are 8 months, and when you calculate it's 32 weeks. So, and there's certain things that determine when a person should deliver. So we know they're supposed to deliver when they are term, and that is 40 weeks, and even earlier if there are certain medical conditions.
Wow.
And we don't want a pregnancy going beyond a certain number of weeks.
Yeah.
So we can't time it when we use months. It just doesn't add up to us. Yeah.
Wow, that's quite interesting.
Some people say 9 months while they are just starting into their 9th month, and that is 36 weeks. And others say 9 months while it's at the end. So you don't really know how to time it correctly. So when we say 37 weeks, 2 days, then it gives us an idea of how
So you guys
far this
count
pregnancy
even the
it
days?
is. We do. We are hectic.
But I can understand. I mean, this is an entire human being that is bringing another life. So you are literally dealing with 2 lives at any given point in time. And provided the father is also there, it's actually 3 lives at the same time.
We do want the father to be there.
Yeah,
please.
yeah, definitely. So we spoke about the scan the other time. We spoke about the early scan, how that it helps us establish the position of pregnancy. When again can a woman expect, or how many scans are done throughout the pregnancy?
It is recommended that they should at least have 1 anatomy scan. And by anatomy, they mean checking every organ on the body, starting with the brain, seeing that the
and
brain
this is
is
roughly
fine.
done at how?
It is done between
gestation?
16 to 20 weeks. That's when you can have it. So that's when we are given a chance that if there's anything wrong, then we can do something about it. But if it's done later on, then there's not much we can do about anything. So the first scan, that is good, and about 19 weeks, 18 weeks, we try and get them an anatomy scan. Of course, in public sector, we don't have facilities, but in private, that's basically what they do, and they do even more scans prior to that. At 12 weeks, they check for Down syndrome, the self markers on Sona for Down syndrome, the nuchal transluence, nuchal fold, and all the
and all of those potential defects.
So, but here generally I'm speaking more about what our people can afford, and it goes to.
On the day of the scan, let's say they went for an appointment, then the healthcare professional told them that on the next visit we're going to do a scan. Is there a particular way that a woman can prepare for a scan, or they just come as they are?
They come as they are. They come.
There aren't any.
No, they are no prayer. Don't eat, do this, eat what. No, we don't have those things. You just be yourself, have breakfast because of the long queues, and then there's no preparing for the scan.
Okay. Yeah. And on the first visit, you mentioned something about the blood test. Let's say this is a fairly healthy female. After those initial blood tests, should they expect to be pricked again?
Unfortunately, yes, because it depends also on the first results. Say on your first results, we pick up that,
for the person that is in front of you.
You see. So in the first blood test, say we find that maybe you have some infections. Like in South Africa, basically we check for your syphilis, we check for anemia, we also check your RH, meaning the blood type that you have, and then HIV, of course. So depending on what those tests say, if they all come out normal, then we don't really need to prick you until you are further gone in the pregnancy. But if there are any abnormalities from there, then we might need to do further testing.
And I think the women at home really want me to ask you this question. When can they expect baby kicks quickening?
With your first pregnancy, here we are speaking mostly about a couple that just got pregnant.
Yeah.
Yes, so you may feel from as early as 16 weeks, but don't worry if you can. It can take up to when you are 20 weeks before you start feeling something. So you don't worry about that. As long as your tummy is growing, you will feel some funny movements from 16 weeks.
Speaking about a growing tummy, at what gestation can a woman or is a woman expected to show? Like now, she's pregnant.
I can't really say, hey, some people carry well.
Yeah, it's different for different people because others you start to see at 8 months and
you're like, oh, you are pregnant when you do the baby shower, but others as early as 4 months you can start seeing them. So it just depends on the body,
so
on
it's
your
actually
body.
different from person to person.
Yeah, but apparently our grannies can pick it up early.
Of course.
I don't know how they do it. But
there's literally so much to unpack on this topic, and we hope that you are learning as Dr. Myla is sharing us the knowledge that she has. We're going to take another short break, and when we come back, we are going to be concluding. So stay tuned. Ladies and gentlemen, welcome back to Medical Insights. Today's episode has been mouthful, quite exciting, and I'm sure you know some of the things that you can expect on this pregnancy journey. Dr. Myla is still in the house with us, but before we actually get to concluding, we have a few tips to read from the Healing to the Nations magazine, and here they're talking about the 12 benefits of eating apples. Ever heard a statement that says an apple a day keeps a doctor away? Maybe you can actually get to find out how that happens. Here on number 7, it says that it promotes heart health. Apples contain soluble fiber that help lower blood cholesterol levels and flavonoids that reduce blood pressure and lower the risk of stroke. I think that's quite, enlightening. And it also says here on point number 6 that it promotes weight loss. That's quite interesting. And they go on to substantiate that apples are filling due to their high fiber content, so you fill up faster with fewer calories. The fiber stimulates bowel movement, which also aids in shedding that extra pound. I see somebody rushing to the store market to get those green apples. Now, please share the following confessions with us. They're actually also taken from the Healing to the Nations magazine. Thank you so much for sharing those confessions with us. Remember that your body is the member of his body. So you are the flesh of Christ, and therefore you have divine life, and that means that you live a life that is far above all sicknesses. You are in charge and you are in control. Dr. Myla is still in studio with us, and before we let you go, personally today, I don't want to let our guests go, but we have to. 3 things that you can say to a woman either planning to expect or already expecting.
The first one, I wouldn't want to say to the woman also. I feel like we are being hard on... Yes, so let's say a couple.
The couple.
So I
said, this is a together journey, remember?
It is, and people are, society is putting it on the woman's shoulder, and it's just a bit unfair.
Yeah,
so
thank you
on
for
that
highlighting
couple,
that.
Be there for each other throughout. It's not anyone's fault if the conception part takes longer than anticipated. They tend to look funny at the woman, but it's their joint journey. It could be a man's fault, it could be a woman's having problems, so it's not entirely on a woman. So hold hands on that journey, and if you have problems, then seek medical attention as soon as you can. in your pregnancy, remember to look after it. It's not just about you. Unfortunately, this one falls on women because as you are pregnant, you are the only one who can look after that child until it's born. So I think women should try and look after themselves when they are pregnant and beyond. Try to find a support system when you are still pregnant, because the postnatal journey is even tougher. So it's important that if you're planning for that kid, don't just plan the pregnancy, but also plan beyond and have room for complications that can happen in pregnancy, because those are unplanned for. But as they happen, have room for them, and yeah, you will be fine.
Wow, I wish we still had more time to elaborate on the taking care of yourself and particularly also that mom and dad bond. I feel like it creates an environment that is conducive for the child to grow in, because these are two people that are emotionally also attached to each other. There's literally so much to say on this topic. I think we should definitely have a follow-up on this topic, Doctor. I hope you will be available to come and share more knowledge with us.
Of course.
And I also had hoped that we'll have more time even now, so that you elaborate on that whole aspect of taking care of oneself, especially when they are expecting. But Dr. Maila, thank you so much. I know that you are quite a very busy woman, but thank you for taking time to come and speak to us and enlighten our viewers. Ladies and gentlemen, this has been Medical Insights. Until our next episode, you know what to do. Stay blessed and stay healthy.